relationship to your period is? If I made you say something in words, what would you say?
Very intimate. It's very intimate. I mean, it became that way over the years, and I cherish it. They're important.
A few years ago, I faced this health problem that was pretty minor. I just didn't know if I was pregnant or if I had some sort of infection. I just really had no idea, and it took me a while to go to the doctor because I was scared. And I just thought, do other people know about their bodies in ways that I don't know about my own body? What am I supposed to know about my own body? It also made me think, am I supposed to be in this much pain when I have my period? It's natural, so why does it hurt like that bad? And the people in this film, they're my colleagues, friends, family, people in my life, and their stories are unique and valuable, but they do not represent the entirety of the menstrual experience, not even a fraction. I'm hoping these are pieces of knowledge for you, a collection of video calls with people I've grown up with or whom I've just met. I wonder if you might see a part of yourself in this piece, just a part, and I hope you do. And if you have a story to share, I really want to hear it. Truly.
I had been told by my mother like years before that it was like something that would happen and like to expect it and like it's just a part of life, and I felt like honored. I sat my brother and my father down like family meeting to announce that I had gotten my period, and my father was just like, "Oh my god, I thought it was going to be something awful." Like my brother was like, "Why are we here? Like why did you feel the need to do this?" And I thought I was like waving my badge of honor. I was like, "I'm menstruating, like this is amazing." They were less impressed.
Oh, but I'm not gonna. Okay, I won't. Okay.
Okay, let's talk about periods.
Okay.
Okay, go ahead. Do your thing.
Okay, let me see.
Hi, my name is Amanda Zell. I am 24 years old, and I'm a second-year medical student.
Hi, my name's Leanna. I'm 24 and I'm a receptionist at Doctor's Eye Clinics.
Hi, my name is Ariana. I'm 24 years old and I live in Hartford, Connecticut and work at Yale in development.
Hi, I'm Elizabeth Wellman. I am 33 years old and I am an assistant professor at a university. Okay, I had my first period when I was 11 and we were on vacation for my dad's birthday in Normandy, France. And I do think that that's kind of hilarious, right? Like that you get your first period basically on the beaches of Normandy. I like told my mom, I was like, this happened. And she was like, yep, that's your period. Congratulations, you're a woman now. And I realized like, oh, the pain and the blood, like the tons of blood, like those are connected. I picked up a book about changing bodies. In that book, there was a page about periods. And then my mom walked up to me and I immediately felt I'm not supposed to be looking at this book. I don't know why, but I immediately felt like, oh, this is knowledge I'm not supposed to have. She said, women who, or I think she said like women use their period as an excuse to be unkind. Sharing your negative emotions are selfish. That's a concept that I felt like I learned really early and that I didn't have a right to sort of complain about that. So I think for me, I felt a responsibility to take it like a man. like, I'm so tough that I have a period and I don't talk about it and I just get on with it. I feel like that's sort of how I approached it. But my gosh, when I was a kid, I mean, as a teenager, I would get so sick, I would throw up. Yeah. and you'd go to work and you'd go to school and you'd go to whatever, and you just were like, okay, this is this like secret, not secret, but yeah, secret thing you're not supposed to talk about, but that is happening while you're living the rest of your life, and you're trying to pretend it's not happening.
I think I got it first before I actually learned about it. I think me and my parents, we don't typically like, obviously then I told my mom and she, brought me the necessary stuff, but like my parents and I aren't the type of people who have like those talks, and that's okay, whether it's like a my family thing or a cultural thing. But so like I really was quite confused as to what was going on. I think only until maybe even right now do I actually know what's really going on down there. And now I'm still learning, right? Like I still don't fully know. Yeah, I do remember like first getting it was like a terrifying experience, as for most people, like, who looks down and sees like blood and they're like, ah, it's okay. No, it was terrifying.
I changed my underwear and I was like, what is this?
Like I remember I was playing tennis, went to the bathroom, and I was like,
On the third or fourth time I changed, I told my mom, I was like, I think I was scared to tell my mom because I thought that like, this is gonna sound so strange. I thought that like I had done something wrong. Now she's gonna be upset that like I'm messing up my underwear. Like, I don't know. Like, I don't even, like, it was just, she would use this expression, and I think it's a more common expression in the Caribbean. It's like you say that like, oh, your stomach is on you. So I'm sure people had been talking about it when I was a kid or whatever, and they would say, oh, my stomach is on me, but I wouldn't like, I didn't know what the heck they're talking about. I didn't know what they were talking about until it had happened to me.
I would get my period right before, the day before every single exam I had during my first year of medical school. And that was very frustrating because, like I mentioned before, the week before my period, I always have emotional mood swings, severe emotional mood swings. So you add that on top of the anxiety and the exhaustion. It was a really bad time for me.
Maybe something that would normally be annoying to me or frustrate me, like normally, like I've noticed that like during my period, I'm extremely sensitive to that particular thing or what have you.
There was one particular week where I had a really bad period where I felt nauseous. I ended up crying out of pain. My boyfriend and I were coming out of Costco and it hurt so bad that I was crying.
A couple hours later, like I had the worst cramps. Like they felt worse than like my actual period cramps. And it just like, I thought I was dying. Like I was on the floor. I was in so much pain that I literally was on all fours on the floor. Like I was just in so much pain. And I called my mom being the dramatic woman that she is, bless her heart, she was like, you're having a miscarriage. That's what's happening. You're having a miscarriage. And I was like, what? I'm like, first of all, when was I even pregnant? Like, what are you talking about? So now I'm sitting here and I'm like in pain and I'm stressed out. And I was like, I can't even talk to you right now. I got to go. So I'm just like trying to figure this out. I'm like, oh my God, what if she's right? What if she's right? And I'm like calling my health center. It was bad. Like I couldn't stand up. Every time I tried to stand up, like I was in too much pain to get up. Like I just laid on the floor for like 4 hours. I could not move. It was just bad. And it was like the pain that started in like my abdomen and then like radiated down to my legs and my back. They had to do a whole procedure on me, 15 minutes, just poking and prodding. And I was like, I don't like this. And turns out just ovulation pains. And I was like, what? I don't know. I got the pictures of like my uterus and stuff. She's like, it looks normal. I was like, I don't even know what I'm looking at. I really don't. The first picture I looked at, I was like, is that a fetus? But it was one of those things that it was just like this huge mystery. And my mom's answer was very dramatic. And their answer was, there's nothing wrong with you. So, yeah.
My mom was very like home remedy type person. Anything even like mildly sexual, my mom is not. She's not really here for it. I'll say that. And so I wasn't taking like any ibuprofen or anything. I didn't start taking anything until like, I think end of high school, going into college and stuff. I was like, okay, like I need to be able, because I literally would like leave. I would just go home. Like if my period came during school, I would go home. Like I'd be like, okay, it's a wrap. And every time when I would try to like push through the day.
And so I went to an OB-GYN and I started birth control. And it's actually been really good. Like, at least now I can, like schedule, like know when my period is coming, and like the blood flow is much less than before, and the pain is not as bad. And I feel like a commercial, but it has been really good.
I'm Emma Fahrenkopf. I'm 23, turning 24 in about a month. And I'm a college graduate now, going towards hopefully being a teacher of some sort, but also a performer. I used to get like chronic migraines, like unable to speak, unable to like communicate, unable to see, only when I was on my period.
I started getting migraines. Oh my God. Hi, I'm Erin Kearney. I'm 26 years old and a third year in the Visual Arts MFA program at The Ohio State University. I would get like body aches in like places that I wouldn't normally, like just like muscle aches throughout my entire body. My cousin also, I mean, like almost all the women in my family have this. And my cousin actually went to a doctor about it and they're like, yeah, that's hereditary.
But I actually solved my migraines through a piercing, like a certain nerve.
I didn't know. What?
Yeah, apparently there's like a certain nerve that you can get pierced with an earring, and mine, I didn't get it for that. I just got it and I haven't had one since. I could not go to school, or I would have to leave school for the day because I just couldn't process. Like I remember like the first one I ever got was in an 8th grade science class. And I remember the board started to become like not visible and I didn't know why. So like my teacher was teaching me a lesson and I realized like I can't see and I can't hear anything that he's saying. And then after that, they didn't stop. So I would get them monthly. Honestly, I said to my mom, like, after I have kids, if I want to have kids, I had joked to her multiple times, I'm getting it removed. I'm in too much pain. I'm getting it removed. Like I'm getting them tied. And of course I said it as a joke, but like there were moments where I was like, I'm in so much pain that if I want to have kids, I'll have them. And then I'm getting it removed. Like I will pay the money.
Birth control is not like, certain birth controls are not the answer for, different people. A lot of people need to try different types of birth controls before they can actually figure one out that works for them.
Like the shot and those kinds of things release the hormones throughout your body, which makes, or like a pill and those kinds of things. And that did not affect me well.
Like, that's the other thing, is like learning about the history of birth control and just being like, why are women the ones to take birth control when it does so many things to your body, like internally, externally, physically, emotionally, all of those things?
Like when I was young, I was like super irregular and I would have my period for like 2 weeks at a time. And I was like 100% anemic when I was like growing up. I mean, there are like contraceptive options that like take your period away. And I've been like, I've like had those conversations with my OBGYN and like, I'm like, no, I don't think that's good for me. Like, I don't want that. Being an athlete all year round, a period is pretty cumbersome because you already have a really pretty in tune relationship with your body in a physical way where you're like pushing it a little bit farther every day and you're in this like constant state of repair. When you have your period, it really becomes kind of a moment of pause. I shouldn't speak for everyone, but like I feel very vulnerable. I used to when I had my period and I was like, in a relationship with someone because I'm like, don't touch me. This is not the time.
I feel gross. Like I know instinctively that menstruation is not gross, but I don't feel good.
And I also didn't want people to know because I was scared that they would think that my behavior was wrapped in menstruation. I was scared that if I was angry because someone upset me, suddenly I was angry because I was on my period. I think my mom and my aunt, because they've always, as long as I can remember, been quite open and honest with their periods and, openly flinging tampons at each other and whatever, laughing. Whereas I think every single male member of my family would be like, why? Like, why? Like, that's like private. Like, you don't see us talking about like going and taking a dump, It's like, well, it's different. If you felt what I felt, your ass would be on the floor, fetal position, asking for someone to bring you Tylenol and chocolate too. You would. My name is Emily Grimm. I am 23 years old and I am an actor / barista. all of the different stores on campus have like basic home goods. They have like paper towels and napkins, but they do not sell any sort of hygiene product. They do not sell pads, they do not sell tampons, they do not sell any of that. And nowhere on campus even sells, not even giving out for free, not even like having access to that. Nowhere even sells any sort of hygiene product. Like, how are our great minds so blinded to this issue that directly impacts half our world population? And yet these people are also in charge of making policies that affect those same people. It's an ambivalence to something that is so important and so shamed for no other reason than it just doesn't affect a certain group, so no one should care about it. And in those ways, like, I can't even imagine being a woman dealing with homelessness or extreme poverty and not being able to purchase what's considered a luxury good from our government, like for basic health and hygiene.
Something isn't happening to you directly doesn't mean that's not important. It doesn't mean that you shouldn't care about it, you know?
But like Black people have, like a lot of Black people have complications with their periods. A lot of people have like really heavy periods or really bad cramps, or even with like other factors that might affect those communities, such as like weight issues and like other like high blood pressure, other health issues that could affect your periods that are so prevalent in these communities are not discussed. And so then when you have like really terrible periods, it's like, oh, whatever. But it's like, these are all part of like your health.
Something that they're experiencing might be abnormal or not good, but like they wouldn't know because like they're not talking about it with anybody, or they feel like, oh, they can't talk about it. Even when we were talking about how we like in school, like how they would do it.
I know we had like one where like the boys and girls would be split up into different rooms. We would learn about our own selective experiences, but never really about the others.
Me personally, I feel like we need to know about we should be knowledgeable about everybody's bodies. You know what I'm saying? Like,
I learned how to put a condom on a banana long before I learned what the hell my clit was. Like, people need to understand how their bodies work. And especially young women who maybe have mothers who aren't comfortable talking to them about it, or have single fathers. Like when I got my period, it was just my dad, my brother, and I. Like my mom wasn't around at that point, and I had to just like figure it out. And while like Google was very helpful and like a lot of trial and error, and again, investigating like worked, for so many people, it's not enough because we're always scared of things that we don't know about.
Hi, my name is Jessica Santulli. I'm 24 years old and I'm a librarian. I definitely didn't feel comfortable talking about it for most of my life. Whenever you don't understand something, it's hard to talk about and you kind of fear it. At 11, I actually got my period and I had no idea what was going on. Everything I learned in that one session of school in 4th grade, like being taught by the nurse, kind of went out the window. Like, it didn't prepare me for what was going on. Could this be it? But I thought you were supposed to bleed, but it doesn't look like I'm bleeding. My mom like found something I had thrown away, so she discovered it. My mom didn't really think she had to explain it because that was younger than when she got it. So the symptoms have probably always been the worst ever since I started getting it. Just be terrible cramps, terrible nausea, acid reflux, that kind of thing, which it's hard for like an 11-year-old to deal with when you don't even know the purpose of this. You don't think about having children, you're still a child. As someone who's a librarian and reads a lot of children's literature, it kind of stuck out to me that not a lot of middle school literature mentions it. It has to start from a young age, possibly when the parents deem that it's okay, possibly to both boys and girls, so that men don't grow up with this fear of it, this like disgust around it. I think it's important to change men's attitudes toward it. I'm not saying it's true of all men, because I know some dads who are like fine with it. Maybe they have like 5 daughters, so they're like, oh, I know all about this. I don't understand why everybody has this pain during that time of the month, but hopefully something good can come out of it.
Maybe our bodies are just built for pain between, like being young girls, growing pains to period pains to menopause, childbirth. Like there are so many different pains our bodies go through.
Hi, I'm Joe. My pronouns are she, her. I'm 24 years old.
I'm Becky. I am 24 years old.
And I'm a PhD student in earth sciences.
And I am a student also working at the same time. I didn't get it until I was like 18 and then not again until I was 20. I was never concerned health-wise. I was super small. My growth was stunted. So the doctor always said it was pretty normal and I was practicing like 20 hours a week. So the first time I got it, it was 4:45 and I had a swim meet and I was home with my mom, my dad, and my sisters. And I ran into my sister's room and woke her up and she was so mad because she was like, it's so early, what on earth? And I was like, you literally need to like show me how to put a tampon in. And then I went to a swim meet the whole day and I didn't know that like you had to change your tampon. So I just left it in the entire day. And then I got home and it was like, it was a disaster. And I was so mortified because I was like too old to be cute about it, and it also interfered with my swim meet, which like to me was the most important thing that I could have been doing. So that was my first experience with it. And then I had 2 years to reflect.
I was on a swim team as a child. And when I got to like age 11 or 12, my mom was like, just so you know, at some point you're going to get your period and I want you to be prepared for when that time comes, which was awesome of her because she knew that like I was super into sports. I was not going to want to miss practice or anything. So she actually bought me tampons then, way before my period. And she said, this is how you use it, read the instructions, try it out, but don't talk about it around your dad and your brother. And like, if I needed tampons and my dad was going to the store, like I'd be too scared to ask him. So I'd be like, Mom, can you go tell dad I need tampons? I don't really get pain from my period, but sometimes I get like, some discomfort. And if I like didn't want to work for part of a day or something, I would be like so scared to tell my PhD advisor about it and tell him that that's why I'm taking the day off. And I think part of that is because I don't want to be like viewed as like less than because I menstruate. As a scientist, like I try to avoid things that are feminine around my like colleagues because that's considered bad. Well, okay, I'm trying to stop doing this, but my instinct is to avoid it. And menstruation ties in with that as well. You definitely don't talk about that when you're trying to be taken seriously, which is crazy.
So I'm Macy Phillips. I'm 29 years old and I am a writer and I'm a grad student at Ohio State University. I specifically remember one time I was asked up to varsity as a freshman. So that was a big deal. And we were at a tournament and I started my period like either right before it or like actually on the bench. And I was in so much pain. I wanted to vomit. I was like seeing light around the edges of my eyes. Like it felt like I was going to pass out. There were, it was a lot of really hard things. And so my dad came over and I'm like, what's wrong with you? Are you okay? Because you could tell something was off. And I was like, I started my period. I have really bad cramps. And so my dad kind of like pulled one of the assistant coaches to the side and was like, she's on her period. And like, and so he was like, oh, okay. That was it. I still played in the game. Like it didn't really affect a whole lot, but that's the only instance I can really remember my coach like explicitly knowing that I was on my period. And that's why I was like not playing well. But otherwise I think I just like dealt with it and tried to not let it affect me as much as I could, or like I said, affect others. It felt like very much like a burden to others if I let it be, which I recognize is like very wrong at this point, but it's hard growing up as a young person. It's like what we were saying before about the pain. Nobody except people who have periods really can understand what that pain is and how it can affect you. And I don't know that it's always believed, which is unfortunate and problematic.
I can't believe I have to go to work right now. I feel so sick, but I'm not going to take a sick day because I'm not sick. And I wouldn't eat anything all day because my stomach gets really sick when I have my period.
I think especially as a person who personally doesn't have a lot of like shame around these things, like fortunately, if I feel afraid to talk about it in some settings as a very open person, that signals to me that probably a lot of people are not comfortable talking about it or being open about it.
So at home, I never felt ashamed or I never felt embarrassed to like ask my mom questions. She's always been very open with us, but it was a completely different story at school. Because I was one of the only ones at the time who had a period. I was like, there was one other girl that I can think of who started her period in 4th grade.
So like, I think about my time as a 5th grade teacher, and like there were times where students would tell me that they had their period, and I often had to think a lot about like what my reaction would be, because if I was like, oh, okay, like, and tried to make it like this hush hush thing, like I don't want them to grow up thinking that it's something to be ashamed of or something that has to be a secret. And I was like, wow, I'm so glad you told me. Like, is there something you want to talk about? Do you need a tampon? Do you want to, like, what's going on? But I think if we start to normalize that and make just like that a conversation, it can change what people grow up to think of as normal or as not.
My name is Yasmin. I am 24 and I am currently in graduate school for nursing.
Hi, my name is Hope Jans. I'm 24 years old and I'm a labor and delivery nurse.
So I remember I used pads all the time just because like that's what my mom gave me.
Me too.
And it just made the most sense to me. I'm like, well, it's coming out of me and it'll catch it. It's fine.
Yeah.
So I was like, but then I was introduced to tampons and I was like, okay, sure, let me try this. I don't know if I ever told you, but one time I like tried to teach myself how to do it, like to use it. But I wasn't on my period when I was trying to use it. And like putting it in was fine. Taking it out was honestly borderline traumatizing. So,
literally because there's no lubrication, right?
Oh yes, exactly, 100%.
It's like you're trying to yank it.
I felt very just like detached with what's like going on down there. I'm just like, she does her own thing. I felt very like not like it, like my body was a whole thing, if that like makes sense, like a whole thing that's like a part of me. So I never even checked to be like, oh, am I like fine after doing that to myself?
When I was younger, I absolutely hated having it. I was in pain all the time and I would not want to go to school because I would just get to school, be in pain, throw up, and have to go home. When I got the opportunity to not have it, I just didn't.
Like in high school, it was just nothing but like fear and pain, which is why I had to do the birth control, because like just nothing could control this pain.
8 to 9 pain out of 10. Nothing worked. Heating pads kind of worked. Sometimes my cat would lay down and start purring. That would be nice.
But what's funny is like I feel like a lot of people talk about having emotional like feelings tied to their period, either like before it, during, or after. I would say like I don't know if I've ever like felt any changes in like my mood. The only thing I would feel is maybe like lethargy and just like not wanting to do anything. But
I don't feel like I was moody, but I feel like I definitely also was, because I would cry a lot. But other than that, that's it. Just pain and crying. And that's it.
To be honest, I think more often than not, I made myself push through it, because I feel like it seemed like it would be like an invalid excuse to not go to school, if that made sense. Like, oh, well, this always just happens to you. Like, you should just deal with it. In college, I was on birth control, right? But I stopped taking it just because like it had just been so long, like such long-term use. I was like, do I really need it anymore? I don't know. So like recently I stopped, but my period actually changed in the last like year or so in terms of like how many days it is. So I'm still like, I feel like I'm now just starting to like really understand it.
Right now, I haven't had a relationship with my menstruation in a long time because I stopped having it. let me think. Like 8 or 9 years ago. Now I'm going to be on the IUD and I'm going to get my period. So I'm a little bit excited. I don't know, like, if that's weird. And my mom's always been super open and like, just, I guess it facilitated my openness to talking about anything and everything now, because she was just super helpful and I was never like afraid to get it. Or
I guess I let my mom know, but in the beginning, I didn't tell my mom when I got my period. She never spoke to me about it. Yeah.
Never.
No, my name's Adrienne Ehlers and I'm in my 40s. And I'm a graduate student getting my PhD. So it means I research, I teach, and I'm also a full-time mom of 4 kids. No, we were very religious. We didn't speak of sex or desire or menstruation so I purposefully tried to skip my period because you spend so much time being scared in your 20s, or at least in my teens and 20s, like petrified of getting pregnant early. I was a dancer, that was my life. I just was very uneducated about what the effect of being on the pill for so long and sort of futzing around with my period.
Was it healthy for me to not have it for so long? And I know birth control affected my hormones and all of that. So I'm kind of also curious eventually when I'm ready to have babies, what my personality and mood and all that will be like when I'm not on any birth control.
Like, I wanted not to have kids for so long. And now that I do want to have kids, how does it work? Like, I had no clue. Yeah, so my first gynecologist was very clinical, didn't look me in the eye, didn't tell me what she was doing. I just remember looking at the ceiling and being like, what is happening? And so embarrassed.
I think it'd be funny to ask a clinician, like, what is going on in their patient's head? Like, how do you think your patient's feeling right now? Especially a young patient or a new patient that's just like their first pap smear or something. Hi, my name is Aisha. I'm a third-year medical student currently studying at Ohio University, based in Athens, Ohio. I'm from Columbus. I did my undergrad at Ohio State. I'm currently rotating at hospitals in downtown Toledo, and I'm passionate about women's health, specifically with incarcerated patients and how to be health advocates for those populations. And I'm passionate about primary care. It's awkward for people because I forget. My one friend has never gone to a gynecologist. I was like, you have to go. And I was like giving her crap for it. She's like, it's weird. Like, I don't want, and she's my age. She's like, it's just a weird concept. I was like, it is weird and it's uncomfortable. I'm like, no one wants to sit in like a sterile room with those bright lights. You know, it's not a good environment at all for anyone.
Yeah, putting your feet in stirrups is like horrible.
It's a horrible feeling.
I think the sheet makes it worse. Like, you know, it's definitely supposed to be for modesty.
Yeah.
But even the word modesty, who am I being modest for? Because there's a sheet there, I'm supposed to pretend nothing's happening. Yeah, it creates this illusion of, it adds to the shame, I think. I mean, it's my body.
I've seen it.
Yeah, I told my friend to like just Google a picture of a cervix and she started laughing. And I was like, well, I mean, this is how you learn, you know, this is what we're taught. So I think, and she asked me questions all the time. And like, this is someone who has a higher education, has a bachelor's degree, and who obviously has friends that are in, and she has, you know, multiple friends in the medical field, in the nursing field, and who is, you know, upper class. And even then, you know, still has questions. So it's like I forget the number, it's like a high percentage of outpatient visits in an OB/GYN office is abnormal uterine bleeding, whether that's heavy or irregular or painful, whatever. It's just not abnormal is the word they use. I remember like, I think I hid it for a while from my mom. And then obviously like moms know, and she like figured it out. When my younger sister got her period, my mom told me. So I mean, now we all talk about it. And I think me and my mom have the same gynecologist. So like, yeah, I think it's hard to say like I'm in too much when nothing is like life-threatening, you know. It's like, do I leave work or do I not go into work for a migraine? But I don't feel like that because I know that people won't question me because of the situation I'm in and the field that I'm in. People trust a medical opinion a little bit better or take it more seriously. So yeah, like as a physician, you just have to know the right questions to ask to take a thorough history. So it's pain in general is just very subjective and there's no way to measure it. Like my mom has acid reflux and GERD and I'm like, how bad is your, and I was like, well, 10 being like giving birth. And I know I could say that to her because I know has given birth, you know. I was like, 10 being giving birth, you know, and she's like, yeah, it's still a 7. I was like, okay, now I know that that's how it's that painful because, you know, we have a mutually agreed upon end scale.
Hi, I'm Megan. I am 26 years old. I am currently a student at Columbia University, and I also oversee business operations for an immigration law firm in the Bronx. I was in college. I gained about like 30 to 40 pounds within like the first couple of months. At that point, I like went 3 months without having a period. Oh my God, am I Mary? Am I about to give birth to the second coming? Is this immaculate conception? I've had this conversation with like several of my Jewish friends, and like apparently we all go through a phase where we're like, oh my God, we're the chosen one. And it took me about 2 to 2.5 years to get like an actual diagnosis of what was going on.
I consent to recording.
Okay, cool.
Hi, I am Molly Minter, and I'm 23 years old, and I'm typically an actor, but currently in this pandemic, I work as a barista and juicer. Yeah, it's kind of a whirlwind every time because I have polycystic ovary syndrome. I think the like symptom of it that is the most terrifying in its own way is like a pretty high percentage chance that I don't have the ability to have children, which it's not even something that I necessarily want. I've always kind of been against having children for myself, but to kind of hear that when you're diagnosed at 20, that it's like almost a medical impossibility, it's a weight to take on because you just don't know what the rest of your life is going to look like. And so it's a weird thing to hear at 20 years old, but
well, my relationship with my period is like, I never know when it's coming. Hi, my name is Michelle. I am from Brooklyn, New York, and I work in government, and I'm 24 years old. So definitely, like, once my condition of like PCOS was diagnosed like this year, it's definitely like good to talk about it.
Finally, I like got my mom involved, and she took me to like this like weird like endocrinologist. He's not weird, but you know, like this like kind of experimental like endocrinologist, holistic doctor. And then they checked my FSH and some of my hormone levels. And he was like, oh, you probably have PCOS. It's an issue with your hormone production. So if you're a person who has a period and ovulates, what ends up happening is you can develop all of these cysts, multiple cysts. That's why it's called polycystic, on your ovaries. That can be very painful. And that's like one of the symptoms that's most associated with PCOS. But at the root of it, there's a hormonal imbalance, and that can affect anything from weight gain, inability to lose weight, cysts on your ovaries. They are super painful. I've had a couple.
Unfortunately, also hospitalized a lot for PCOS just because my ovaries are tricky little devils, and they like to explode when I least expect it. Yeah. It was really funny because like on Tumblr, everybody in 2014 was like, oh my God, my ovaries are exploding. And then that happens to me all the time. So not fun.
And hair loss, hair growth in unwanted places.
For me, like my facial hair grows back really quick. So I feel like I always have to be getting it done. Sometimes it has made me feel like not to feel like a woman just because of the extra body hair, and I know hair is also like another stigma. So definitely there were moments in the past where I would feel depressed and I wouldn't feel pretty, for having like extra facial hair, but now I'm at the point where I'm just like I can't keep living like this.
One of the things that a lot of people are concerned about is insulin resistance. Essentially, having PCOS will cause you to become insulin resistant over time, which leads to the development of type 2 diabetes, which is why a lot of women or just people in general who get diagnosed with PCOS, one of the first things that they get prescribed is metformin.
And I just feel like it's kind of like my body has placed me in this higher risk of getting other certain complications. Like, what does it mean when one's hormones are in balance? Like, what does that entail? Like, how does that also affect the rest of your body, you know? I'm just like, why didn't my doctor or, ever say anything? Instead, she just put me on like metformin, and I kind of started my period process, but she never really explained, I guess, like how that medicine will affect my body. Like I said, I don't want to rely on it for the rest of my life.
One of the big symptoms of like when you're first diagnosed with PCOS is irregular periods. So there was a long time before pre-diagnosis that my periods would kind of just stop for a while, or I would have more periods than normally people would in like a month, and I would bleed very, very irregularly, both like too much or too little or whatever. So now it's pretty regulated because of birth control, which is good. It already can really mess with my mood, and I am a person with bipolar, so I already have mood swings. Like, that's already my life. Like, so it's not easy, right? And so it's like I need the right care for these things. And again, I'm somebody who has a really, really great access to care, so I cannot even imagine what it would be like to live without it. It boils my blood.
Getting diagnosed with PCOS is just kind of one in a series of just like medical challenges faced by women in general when trying to get their like symptoms taken seriously. 5,000 times worse for women of color. The reason I got my diagnosis is because my mother was willing to pay outside of our insurance to go see the specialist who doesn't take insurance.
The world expects me to have a period, right? Because they see me and they see what they see and they expect it. And so I think it's such a hard thing because there are so many people that maybe even want to talk about it, but society doesn't expect them to have it and therefore doesn't want to hear their perspective.
Gender, class, color, all of it plays into how easy it is to get a diagnosis.
Like, my doctor's pretty responsive when it comes to like my symptoms. Just me having the ability to speak English is like another thing, and having health insurance too, because I know so many other family members, who don't speak English and don't have health insurance, so they just brush off symptoms like it's nothing. Some people, just because they're an immigrant, they can't qualify for like Medicaid, stuff like that. And also health insurance is so damn expensive for no reason. Like, I've been fortunate to have been at a job that provides me like free health insurance, compared to people who pay like hundreds of dollars for minimum coverage. It shouldn't be like that at all. And when it comes to like a process like having your period, it's like part of your, it's part of like your body development. It's also part of the way your body functions. And if you're not getting your period, you need to like figure out like what's going on.
Hi, I'm Bakshan Kaur, and I am a senior at The Ohio State University studying molecular genetics. I'm 21 years old. I grew up with PCOS. I started my periods when I was 11. But since I was little, I had all this hair on my body. And in India, shaving's like not very acceptable. People prefer waxing. So it was like, and waxing was scary to me with the amount of hair I had. Somewhere down the line, it did have an effect on me. I mean, I would not get my periods for months. And as a result, I would have more of a hair growth. Once I reached like 14, 15, I started having hair growth on my face. So for me, it like I got bullied because of that hair, like in school, and because of all the bullying and the mental health issues, I had a hard time speaking in public. Like, I would stumble, and before I come to the United States, there's a exam we have to take. A day before the exam, I collapsed. I'm like, I can't do this. My teacher was like, just speak about whatever you want to. And I was so done. So I went on a rant about how much periods hurt and how much I hate that I can't talk about it. And after that, I had a panic attack. But after that panic attack, I was never scared to speak in public. So menstruation is not just like, I'm bleeding. It's a lot more than that. It affects your whole body, but it's not seen like that.
Hi, my name is Leah. I'm 23 years old and I am a graduate teaching associate at Ohio State, and I do research in activism in the theater industry. Was that too formal, or do you want me to do like more casual?
That was beautiful and so charming.
The first word that popped in my head was volatile. But then I'm thinking it's not really volatile, because I would say I have a pretty mild period compared to some other women. I think more so it is mildly inconvenient. I don't know. I don't see toilet paper full of clots and get disgusted, but I'm also not like, oh my God, the beauty of Earth's processes. Like the moon is radiating through me to deliver this fucking uteral tissue. Like, no, it's just there and I'm annoyed by it, you know? I learned it was blood when my sister and my cousin, who had already gotten their periods, I think it was the same year, they were like talking about it and they were like, yeah, I don't use tampons because I'm not a slut. Like, and they were like saying that, right? And I was like, you know, little cousin, little sister trying to be included. I was like, oh my God, let me talk to you guys. And they're like, no, you don't know what this is like, so you can't talk to us. And I was like, I know what a period is. And they're like, oh, do you? What is it? And I was like, it's when you pee, your pee is red. That's what it is. And they were like, no, it's blood. And I was like, they really didn't sugarcoat it either. They were like, it's blood. You're going to bleed. Your vagina's going to bleed. Like, and we, in 5th grade, they separated the boys and the girls. And she passed around this little bag that she had, like filled with like pads and tampons. Actually, I don't think she had tampons because we were a Catholic school.
I remember there was a lot of talk about like, how do you handle this and how do you stay discreet as like a lady? I'm Jessica Hightower. I'm 22 and I am an MFA scene designer at The Ohio State University. And so they gave us like this little like, it was like purple or pink. It was like this little pouch and it had like 2 liners and a pad in it. And of course there were no tampons because I'm in Texas and that's a sin.
And she was like, and we're not going to tell the boys about this. This is between us girls.
I don't remember when it was. I don't remember how old I was, but I just remember it was like early in my period years and I needed tampons. And so my mom and me had gone to the grocery store and like got a box of tampons along with our groceries. And then they were like in the same bag as some food. And I just remember my dad being like, why are these in the same bag? What is this? And it might have been a joke, but still it's like that idea of like, why am I seeing this? Like, keep this to your private little bag that they gave you in the 3rd grade.
Especially like one memory that's sticking out is I was at my dad's office. It was on a weekend and I started bleeding and I bled through my sweatpants and onto his like work floor and I didn't know it, right? And so I got up and I like walked to go, I don't know, like to the kitchen or the bathroom or something. And he saw the blood like on my pants and on the floor and he was like, oh my God, you're bleeding. And I was like, what? And he was like, you're bleeding. And he was like freaking out. And I like looked at the floor and then I looked at my pants and I was like, oh, I started my period. And he was like, oh my God, are you okay? Do you need anything? Like, do we need to go to the hospital? And I was like, no, I'm fine. Like, I'm just take me home. Like, I want to get a pad. Just take me home, you know? Having to deal with men's feelings about my period before I could deal with my own feelings about my period, you know? Cis men at least do not have experience with the period. Then you don't have a say in what women do to cope with this oftentimes traumatic event that happens once a month.
I mean, it's a bodily fluid. People are grossed out by that. That might be it. I mean, it's a big question of like women's reproductive rights too. Because like if we don't talk about anything involved with it, then we can move on with all the laws that are being made and all of that against us.
My name is Nicholas Shannon Savard. My pronouns are they, them, and theirs. I am 28 years old as of 2 days ago. Happy birthday to me. I am currently a PhD candidate at The Ohio State University in the Department of Theater. I am a theater educator, director, solo performance artist, and scholar. I do a lot of work around queer, feminist, and specifically transgender theater and performance. I've got a complicated relationship with menstruation. So I named my uterus Bertha because I just needed to be able to like separate this out. I found out I had endometriosis later on. So menstruation and ovulation are extremely painful. And every time going to the hospital, not being believed by the emergency room doctors that this is what was happening. Women with endometriosis have not gone to the hospital while having a heart attack because it was less painful. As I kind of grew to understand my gender identity a bit more, my relationship with that became more complicated, because the more kind of masculine I was presenting, the less like people were ready to hear about it. So I felt like I couldn't talk about it anymore. And I found out like on average, it takes like 10 to 12 years of chronic pain for most women to get an endometriosis diagnosis. I was given the option of taking another form of birth control, which I'd already switched like 7 times at that point. He said I could either do that or get pregnant, which would give me relief for 9 months, but then I would also have a small human. I was specifically told my future husband might want children, even if I did not want to have children. They were very intent on preserving that, regardless of my quality of life. Endometriosis, what's going on in your body is your uterine lining, usually in a healthy body, it'll grow on the inside of your uterus and build up. And then your period is basically when that kind of dissolves and flushes away, so that it doesn't get too built up. Basically what it's there for is like to prepare the walls of your uterus like for an embryo. What endometriosis is that uterine lining grows outside of your uterus, usually in other areas of like your pelvic region. So mine was growing all over my ovaries, my fallopian tubes, a bit into my lower intestine. My uterus was stuck to like my back pelvic wall, because this stuff is also, it's like this like spider webby kind of texture. And they found all of this in me when they did surgery, but basically what it feels like is you just kind of feel like this sort of heaviness. In my case, like it was pulling on organs and making them stick together, which was very uncomfortable. Last year, I got a hysterectomy, finally, which for me was for treating my chronic pain. I managed to get a hysterectomy as like gender confirmation surgery for being trans.
Really?
Because endometriosis, hence my uterus and ovaries, were causing lots of gender dysphoria. There were a million hoops to jump through with that one. Like I had to have 2 separate psychiatric evaluations, a medical examination, and a letter from that doctor. I had to get it approved ahead of time by my insurance, and then actually find a doctor who was willing to operate on me.
My sophomore year of high school, they started getting really painful, and then they would start lasting longer. 7 days at the minimum of bleeding. I think the longest I ever went was 15 days. And they were like really, really heavy. It hurt even when I wasn't bleeding. to the point that I like had to stop what I was doing. Like there were times I would be driving and I'd like have to pull over and let them pass, or I work in a scene shop, and so it's very like physical, like I'm working with tools and stuff, and so I'd be like in the middle of doing something and I'd just have to stop and just like stand there, like lean on a table or something for like 5 minutes. So then I went to the doctor and they were like, oh, you have endometriosis. And then they put me on birth control, and that like helped for a little while. And then it started kind of coming off of it. I guess my body just got used to it, or it was too low of a dose or something. And so then I just sort of, it was like, you're taking a medicine? What? I got a new doctor about a year and a half ago, and he was like, okay, I'm going to put you on this trial drug. Basically it like puts me in, if I understand right, it puts me in like a premenopausal state. And so I just don't have periods anymore. Yeah, I've been on that for almost 2 years now, and it's all peachy, and I don't really have pain anymore. But I don't have periods anymore either. I'll probably have to have another laparoscopic one to like see where it's at, because you can't really tell without like actually going in. Sometimes they can see a little bit of like scar tissue, or if you have like a cyst that forms. I'm gonna have to eventually have either like some sort of removal, or maybe even a hysterectomy, depending on how bad it gets. Like my doctor is talking to me about like, well, if you want to have a kid, like we don't really know how long you have, like you need to start thinking about that. Like if you're in a spot in your relationship where you feel good about it, maybe y'all can start trying. And I was like, I'm not ready for that. But it's like I've asked several times, like, well, how many years? And he's like, honestly, like it could be 5, it could be 20. Like it's really hard to tell, because unless you go in and look, you don't know how quickly it's growing. So yeah. And I definitely do want kids at some point. And it'd be really great if they came from me, but at the same time, like if I need to adopt, that's an option. That's okay.
Hi, I'm Janine Thompson. I am turning 63 next week, and I am a performer, creator, director, teacher, and staging intimacy specialist. I think that's who I am. When I had it, I had what I found out relatively early, like maybe my late teen years, that I had endometriosis. So I had numerous surgeries to address that until I was right around 40. My doctor felt something questionable and sent me to get an ultrasound, which, I'd had so many because of endometriosis. And they found that I had numerous very large, they associate it with fruit. So these were like orange and grapefruit sized tumors all in my pelvis. And they thought it was stage 4 ovarian cancer. So my life completely shifted, and I went on bed rest because they didn't want any torsion. And I went into surgery at the James, and I came out ready to, they were going to take everything out. So a complete hysterectomy and a oophorectomy, where they actually take the ovaries and the tubes. So they take everything and the cervix. And I thought that I would wake up not only in menopause, but having to deal with radiation treatment. So when I woke up, they said they didn't think it was cancer. And the test actually came back, a few weeks later, that it wasn't cancer. It was all endometriosis.
Well, that must have changed your life.
It did change my life. And having all of those surgeries in my pelvis really changed my my connection to my body and my center, and with being a movement person, it's like with that amount of scar tissue and wanting to push away pain and fear, it has caused a lot of need to do therapy to reconnect with my body and not hate it or reject it in a whole new way.
Oh, I feel like a celebrity. I want to see if you want to show me what comes out of you in dance. Let's do it.
Yeah, my name is Yıldız Güventürk, or Yildi, or Sarah. I'm 28, and I am an artist. I lived in Germany for a year, and that's like when my periods got super irregular. Like I probably didn't have my periods for a whole year, and it was creating a lot of like stress. So I was like on the birth control pill for like regulating it. I saw some doctors and stuff, but it was coming, but my body was like still, it was not really doing, like it wasn't natural. It felt like it was like a simulation of period. Like it didn't really, I mean, it's happening obviously, like you're changing the hormones in the body or whatever, you're like triggering something chemically and the blood starts flowing. But it didn't feel that way. It just felt like I was just forcing my body to do something that it didn't want to do. Clearly it wasn't ready to. Like you always say that we're not making babies, like we're not ready to have a baby right now. Like we're not gonna produce anything, or we're like we need everything for myself. I'm keeping everything. That's why the person thought it was polycystic ovary syndrome. It was like I was ovulating, but I was like the eggs were just like staying there. They wouldn't like go to the.
They wouldn't go down the fallopian tube?
Yes, they wouldn't go down. They would just like stay there.
I felt victimized by my own body. Which is really awful. But it wasn't always awful, like monthly, just enough. From water, we come, and from water to water we go. You know, so many people say dust to dust, but I really think from blood to blood. So it did directly impact my artistry.
I'm an artist. If something needs to explode, I'm a dancer. So I'm gonna make something. This is what it's about. Like creative and like sexual energy. I like it. I mean, I don't like the pain, but it's a part of it. And the like texture of the blood changes, the smell of it changes, I think. It becomes like very, it becomes denser, I think, as we grow older. And because like the hormones change too. And then when I started having them regularly again here, it just made me so happy. And I started like cherishing the pain too. Like I have more cramps than I used to. You have that, like you can host a living creature inside of you. You have that thing. Like you have space here that you can carry things here. You can like, it's just like so fascinating.
Was it always fascinating to you?
No, it's just coming to me now that I'm talking to you.
My name is Kasia Kolonovska. I'm 23 and I work in marketing in public health in New York City. I have an IUD. I had very irregular periods that, you know, every doctor would always be like, it'll even out when you get older. And then it just never really did. I think the clinical term for what was going on is dysmenorrhea. They always were just like, well, if you want to regularize it, you can always get
the hormonal birth control pill. And I'm like real scared of that kind of thing. Like there's a history of breast cancer in my family. Wanting to choose a birth control, I ended up choosing the copper IUD. And then my life was a constant period for the full year that I had that IUD.
What?
Yeah, basically just developed chronic pain. I was clinically depressed. I almost dropped out of school my sophomore year because I literally I couldn't get out of bed. It was horrible. I was told that I can't wear a pad every day because it's just going to mess up the pH of all that. So they were like, just literally have black pants, black underwear, and just free bleed some of the time because you can't. But after a year, I had it taken out, and then I switched to the hormonal IUD, and all my problems went away.
Recently, I got an IUD, right? And I thought that was gonna get rid of my period. That's kind of why I got it. And it just didn't work out that way for me. I guess I'm in the rare percentage of people who have this IUD that still have their period. Alrighty, hello. My name is Lillian Brown, and I am, how old am I? I'm 26. I always forget how old I am because it keeps changing. And I am a MFA acting student at The Ohio State University. This is my last semester here. Maybe I should get this thing taken out. I don't even know if you would call them cramps because it just felt way more than that. Honestly, I was like, is this what childbirth feels like? They were like, well, just keep taking your ibuprofen, which didn't work. It didn't work. At least a couple months afterwards, I would have those really intense pains just out of the blue. And that has subsided. I don't get, cramps to that intensity anymore. But it's definitely different than before I had my IUD.
For context, my parents are Polish, right? At home we spoke Polish. But when I'm learning about all these words and all these things having to do with sex, that was all in English.
Once my grandma, this is when I got my period, so she felt like she had to tell me about when she had her period back in the dizzy. And then they would just use these old rags to soak up whatever blood or whatever menstruation, and then go down to the creek and sort of wash out their period rags. And she actually bought me a washboard. And she was like, you need to scrub your panties with this.
We'll have these conversations and she'll sometimes be like, I straight up did not know that about this biological thing, or because growing up in Poland, and which is super conservative Catholic country, and also without the internet, you take what the church and your mom and school tells you, and that's that's what you have.
Yeah, I feel I've just been getting my information from YouTube.
Yeah.
Random people on YouTube. So that's why I'm saying I don't think there's enough information really for people out there.
I remember I had a particularly weird random 2 days of spotting, and I didn't know what it was because it wasn't a full period, but it was suddenly just spotting out of nowhere in the middle of my cycle. And I thought God was punishing me for having lustful thoughts. And I literally was like, okay, God, I will pray to you, and I promise I will no longer have lustful thoughts if you'll let me be free of this scary thing that is emitting from my nether regions. And then it went away, and I was just like, okay.
Reproductive health has been weaponized to keep people that bleed oppressed, honestly. It feels the stigma is some sort of control.
Hi, my name is Erin Elise. My pronouns are she, her. I am a student right now, and I am studying particularly intimacy and staged combat and movement overall in theater. And I'm 29 years old. We're pretty cool, actually. Me and my period have never had, a tumultuous relationship. And she is not anything wild. She's never been wild. Like, I'm remembering a Changing Bodies film that we watched in like 6th grade, but I feel like I knew about it before then. But nobody talked to me about it. I mean, I feel like maybe like watching Degrassi. Like, I remember there's one episode where the girl is wearing like white pants or a white skirt or something, and she gets her first period. And I feel like maybe that was part of my education. I have an IUD now, and so she's super consistent since then. And it's just like a little tiny baby period.
What
I got urinary tract infection the first time that I had sex after I got it. And I think it was like a combination of lots of different things, but the doctor told me that sometimes women have like wilder sex after they have an IUD because they're like, there's no condom, but they're just like, woo, like just getting more wild. And I think maybe it was that, but maybe, I don't know. I don't know what happened, but I had a urinary tract infection.
Had you never gotten a UTI before?
Mm-mm. Have you had one?
You know what? When I was young, I would get them a lot. I would get them a lot, yeah. But I remember I went to your house like recently and I told you that I got a yeast infection for the first time. I'd never gotten one of those.
I get those so much. I get those so much. They don't, like, I didn't have a regular doctor until recently, just through OSU. So I would see different people and they would be like, here's how to fix this problem that you have, but they didn't know it was like a reoccurring problem. Yeah, periods are stigmatized. It's blood coming out of a vagina, which already feels like a dirty word. Like period blood like has a very specific smell. And so that feels like gross. Half of us have them. Or have had them. I think it would be really cool if they were more public. It's bizarre that they're not. I mean, it feels weird that they're not. It feels weird that like our parents didn't talk more to us about them before we got them. I wish, I don't know, there was like so many jokes of like talking about sex or talking about periods. Like from my stepmom, like that's kind of how we talked about it. I wish someone had just been like really real and said, like, here's some experiences that I've had. Here's what I've learned. Here's kind of what to expect. And right now it feels like that would be weird and inappropriate to bring up. Or something would have to be really wrong. Or you would have to be like super tight with somebody and you would only talk to them about it. That feels like the world that I understand we're living in.
Ernest Hemingway, yeah. Yeah. Okay, I'm being interviewed, please.
Yeah, Linda Benson is,
Unfortunately, I did not have great periods. I used to have very bad cramps, you know. They improved as I got older, and I think your environment definitely affects you also. I had a prescription for like Motrin. That's before Motrin, before you could get it over the counter. But back then, you did not. So I had a prescription for Motrin. It probably was stronger than what you could get over the counter. But it really didn't help the cramps, you know. What I found later in life would help with cramps was Advil. Advil worked much better. And it was usually just that first day that I would really have the cramping. The next day, it was almost like I just had a relief. You know, it was just like, oh, I got through this, you know. I just did the marathon. One doctor told me it was like every time I got my period, it was like going through labor. The cramps that I got. I used to think that maybe I had endometriosis, but when I went to the gynecologist, they said no, you know. But even in school, it was almost a taboo. I remember having cramps in high school, going to the nurse and telling them I have really bad cramps. And she thought, oh, I just want to get out of class, to the point that I was like almost on my fours. The pain was so bad that she finally called Omi, and she said she really suffers. Well, it was too late for me to even take anything anymore. The time Omi picked me up, I mean, I was white as a ghost. It was, the pain was so bad. Yeah. So a lot of times people think you're just faking it when you tell them this is very painful. I used to think a lot about it, that I was very lucky to be a freelance illustrator, because if I had a 9-to-5 job, there probably would have been, well, I mean, besides a cold, but there might have been times that I would have to call in sick because I would have had really bad cramps. I had one time I had to do that. I had a photo shoot, and the photographer knew me very well. And we set up the whole thing with model, and I was forcing myself that I could make it to get onto the subway and go into the photo shoot, but I had to actually cancel the photo shoot because I had really bad cramps. And I thought, there's no way I'm going to make this into the city and then do this photo shoot without being in really bad pain and then try to do this. So we rescheduled, but I only had to do that once. So being a freelancer definitely helped, you know, then if I had a consistent job that I had to be at every day, you know, could have maybe been a problem. I probably would have went on the pill and stayed on the pill more, so I wouldn't have had that situation. You know, Omi never really discussed it much, but I remember when I first got my period, it was very, very awkward because back then you wore like belts. They're almost like belts and they wrapped around. It was the strangest thing. And then you attached a Kotex to it.
When did you stop wearing like the belt? When did you get to wear?
I don't know, but I guess it's when they started, you know, coming out with better technology for women. My fear was that maybe that you would get cramps like I did, you know. I don't think you did as severe. Sometimes you did, you know. And I remember I wasn't feeling well because, you know, when I had the C-section and everything, but Dad was in the room and holding you. And one of the nurses came in, and she came in and sponge bathed me because I was bleeding so much, you know, and it was warmth. It was warm. And that was beautiful for me. That was like, I shed the blood, right? You know, and I gave birth to you, and she was cleaning me, and it was warm, and it was okay, you know? So, so that's like having your, it was, I had my period then, and I had no cramps, and it was just, I couldn't ask for anybody that, I thought it was such a, I know that was her job, but I just thought that was a beautiful thing for her to do for me. It really made me feel good.
What would you say to her?
Thank you. Thank you.